If you show the first symptoms of rabies, your fate is sealed. This isn't clickbait, and it's not a metaphor. It is a medical fact. The internet is full of tales about miraculous cures. You've probably heard of that unique case where doctors managed to save a girl bitten by a bat. But they forget to tell you the main thing. It's pure survivorship bias that gives false hope. Since then, doctors have used this protocol dozens of times worldwide, and it failed miserably. There is no miracle. The statistics are relentless. The survival rate tends to zero, and the few who survive are forever trapped in a ruined body. Today, we are dissecting nature's perfect weapon, rabies. Why is the virus so effective? It tricks the immune system. A bite, animal saliva in the wound. Any normal virus would go into the bloodstream where white blood cells would devour it. But rabies doesn't go into the blood. It finds the nerve endings in the muscles, hacks them, and through the nerve fibers, like through a shielded cable, it crawls to the spinal cord and the brain. The body sees nothing, no fever, no inflammation. The virus travels at a speed of half an inch to an inch a day. This is the incubation period. And it's the most terrifying part of the disease. It can last a month. And in exceptional cases, the virus sleeps for up to 7 years. You live your life, you work, while the pathogen slowly crawls toward your brain. The virus is completely invisible to standard blood tests, and this leads to true medical disasters. Worldwide, there are dozens of cases where a patient died from an unknown brain inflammation. Doctors harvested their organs for donation, kidneys, liver, corneas, and transplanted them to other people. A few weeks later, all the recipients died agonizingly from rabies. The virus was simply sleeping in the nerve tissues of the donor organs, waiting for a new host. As soon as the virus breaches the blood-brain barrier and enters the brain, the timer starts. Rabies isn't just a disease, it's a hack, biological programming. Essentially, a real zombie virus. It doesn't kill cells immediately. It specifically hijacks the amygdala and hippocampus. These are the centers of fear and emotion. The virus takes the wheel. It disables the instinct of self-preservation. It turns on pure, uncontrollable aggression. It needs the host to bite. A bite is a direct injection. It's no longer an animal. It's a blind vehicle for the virus. The disease has two faces, furious and paralytic, and wild nature shows them in all their glory. Bats, the main reservoir of the virus in the US and a hidden threat everywhere. Their teeth are like needles. People often don't even feel the bite in their sleep. If you find a bat on the ground that is convulsing or simply cannot fly, do not touch it with your bare hands. It's not an injury, it's paralysis. Foxes. In them, the virus erases the instinct of self-preservation. A rabid fox doesn't growl. It approaches humans. It acts affectionate. It behaves like a domestic dog. It's a trap. Raccoons. With brain damage, the animal loses its orientation. A raccoon comes out during the day, even though it's a nocturnal beast. It staggers. Its movements are out of sync. Its gaze is glassy. It just sits on your lawn, breathing heavily. Or rats in an urban environment. Neurological destruction forces them to run in endless circles, blindly smashing their heads into concrete walls until death occurs. But the most terrifying stamina belongs to large predators, wolves. The furious form of rabies disables a wolf's sense of fatigue and pain. An infected wolf can run non-stop for up to 60 miles. It neither eats nor sleeps. It turns into a biological missile, biting everything in its path until its brain completely burns out. We listed the wild ones, but we forgot the most common urban threat, stray cats. Cat bites are deep and puncture-like. Their teeth, like needles, drive the virus-laden saliva right to the nerve endings. The chance of infection from a cat bite is colossal. And who can't you catch it from? Birds, reptiles, fish, and insects. Rabies is the exclusive curse of mammals. A pigeon, a snake, or a tick won't infect you with it. Ticks have their own nightmare in store for you, but we'll talk about that next time. But who is the most dangerous to humans? The ones you least expect, our own pets. The movie stereotype is a dog foaming at the mouth. But in reality, the furious stage begins with terrifying oddities that owners often write off as poisoning or stress. The dog's voice breaks. The bark becomes hoarse, cracked, and breaks into a chilling howl. The virus hits the psyche. Hallucinations appear. The dog frantically snaps its jaws at the air, trying to catch invisible flies. A twisted appetite sets in. The animal swallows stones, sticks, dirt, and its own feces. Then comes the stage of organic destruction. The dog loses orientation and can run in circles endlessly for hours, crashing into obstacles until it collapses from exhaustion. But, paradoxically, it's not the furious form that will kill you. You'll jump away from a dog like that yourself. You will be killed by the quiet, paralytic stage. In the quiet form, the dog hides in a corner. It can stand for hours, pressing its forehead into the wall. This is an attempt to relieve the hellish intracranial pressure. Then comes the paralysis of the lower jaw. It drops open. Drooling begins. The animal cannot swallow. Outwardly, it looks exactly as if the dog is choking on a bone. And what does a loving owner do? They reach into its mouth with their bare hands, trying to pull out this non-existent bone. There are always micro-abrasions on your fingers. The infected saliva enters the fresh wounds, reaching the nerve endings. Exposure is complete. The virus doesn't even need teeth. A bite is just the most convenient vehicle. A dog or cat can simply lick your lips, your eye, or a fresh scratch on your arm. That's enough. Contact with a mucous membrane, and the virus is already inside. There have been cases where cavers got infected in bat caves simply by inhaling the aerosols of infected urine and saliva. But you won't get infected from a steak or a BBQ. The virus is thermolabile. It dies quickly in the open air and is instantly destroyed when boiling or grilling meat. Raw meat in your dog's bowl is not a threat either. The virus doesn't concentrate in muscle tissue, and the aggressive stomach acid of a predator kills it completely. Farm cows get rabies too. They get bitten by foxes. But livestock isn't mass vaccinated. It's not economically viable. So the farmer always risks their life, but the meat buyer does not. A common fear is saliva. A rabid dog drooled on your pants or bit your pet. You touch the fur, then rub your eye. Are you infected? Theoretically, yes. The mucous membrane is exposed. Practically, it's a matter of minutes. Outside the body, the virus is extremely weak. It's destroyed by UV light. It can't survive drafts and dryness. It degrades at a phenomenal speed. The saliva on your jacket dried up? That's it. The virus is dead. You won't get sick from petting your dog a couple of hours after a fight. But as long as the saliva is wet, it's a biological weapon. Only touch the fur wearing heavy-duty gloves. And a short but vital note for those who love exotics. Wolfdogs, hybrids. If your regular dog bites someone, it gets a 10-day quarantine. If a wolfdog does it, it will be put down. By law, the rabies vaccine is not recognized for wild hybrids. Your piece of paper from the vet means nothing. The animal will be seized, euthanized, and its skull cut open to send brain sections to the lab. We covered this legal trap in detail in our previous video. The link will be in the description. But what happens to a person when the incubation period is over? The most terrifying thing at this stage is complacency. People come to the hospital when the fever and body aches have already started. The person sits on the examination table, fully conscious. They expect to get hooked up to an IV, clear the toxins, and go home. They might even joke with the doctor, but the doctor looks at them and realizes they are looking at a dead man walking. From this second on, you will not be treated. You will simply be isolated and, most likely, strapped to a bed so you don't injure yourself during convulsions. Think these cases are rare? Look at the map. Antarctica, Australia, and a few islands are clean zones. But Africa and Asia are a conveyor belt of death. Around 60,000 people die every year simply because of ignorance and the belief that it will pass on its own. And then, the isolated patient is brought a glass of water. Rabies is called hydrophobia, fear of water. But this is not a psychological fear. The person is agonizingly, desperately thirsty. But the virus has already precisely destroyed the swallowing centers in the brainstem. The moment the person tries to take a sip, a violent spasm of the larynx and diaphragm occurs. The person chokes. The brain remembers this pain. And soon, the spasm triggers simply at the sound of pouring water. But the virus goes further. Aerophobia begins. It sounds harmless, but in reality, it's extreme hypersensitivity of the skin, the slightest breeze, a draft from a cracked hospital door. Even the doctor's breath near the patient's face causes a savage laryngeal spasm and a panic attack. The patient is literally suffocating from the airflow. Why does the virus need this? It's as brilliant as it is terrifying. Under no circumstances must the patient swallow their saliva. The saliva, packed with billions of new copies of the virus, must pool in the mouth. To be passed on, the virus takes the body hostage. The end will come from cardiac arrest or suffocation. We mentioned the girl who survived. The famous Milwaukee protocol. Anti-vaxxers often use it as a shield. The girl was put into a coma. They shut down her brain so the virus wouldn't burn it out. Pumped her full of drugs. She survived. Sounds like a miracle? No, it's a genetic lottery. Turns out, the girl had an extremely weak bat strain, plus an anomalous natural immunity. The doctors simply bought her time. After her, this protocol was used dozens of times on other people with typical strains. The result, a 100% fatality rate. Today, the protocol is considered a failure. There are no miracles. Survival without a vaccine is zero. We are used to clear vials from clean laboratories, but the history of the first vaccine is absolute horror. 1885. Chemist Louis Pasteur takes a mad risk. A 9-year-old boy is brought to him. The child has been savagely bitten by a rabid dog. Pasteur is not a doctor. If the boy dies, the chemist will face trial. There is no safe treatment. There is only a murky emulsion. The dried spinal cords of a rabid rabbit. Pasteur injects this suspension into the child's abdomen every day, aggressively increasing the dose of the live virus. 13 days of despair, a blind experiment on a human being, and the boy survives. Today, the vaccine is perfectly purified, but the principle remains the same. A logical question arises. If the disease is so terrifying, why isn't the vaccine given to everyone in childhood, like the tetanus shot? The answer is pure pragmatism. The rabies virus is not airborne. You won't catch it on the subway. The risk of a random encounter is minimal. Only those who walk the edge get pre-vaccinated. Vets, forest rangers, hunters, and cavers. For everyone else, perfect medical math applies. Bite, shot, survival. The virus crawls to the brain slowly. Doctors simply stay one step ahead. They manage to build immunity before the virus reaches its target. That's why there is only one survival protocol. Bitten, scratched, drooled on an open wound. Step 1, water and strong soap. Not peroxide, not alcohol. Soap. It destroys the lipid envelope of the virus. For 15 minutes under heavy water pressure, you mechanically flush the virus out of the wound. Step 2, the ER, immediately. 40 shots to the abdomen is a myth. Today, it's 5 injections in the shoulder. If the dog is a stray, you take the full course. If it's a pet, you put the animal in quarantine. The virus appears in the saliva 3 to 10 days before death. If the dog is alive after 10 days, it means there was no virus in its saliva at the time of the bite. The shots can be canceled. And what about your pets? Remember the main thing. If an unvaccinated dog is bitten by a guaranteed rabid beast, there is no emergency rescue protocol. The distance to the animal's brain is minimal. The virus strikes too fast. The vet has no right to risk themselves and your family. It's either 6 months of harsh quarantine in an isolated veterinary clinic box at your expense, or euthanasia. Period. But if the animal was regularly vaccinated, the rules of the game change. The dog gets an emergency booster, a powerful hit of an additional dose that stimulates immune memory. Antibodies burn out the virus right in the wound. For a regularly vaccinated pet, a rabid beast's bite is a trouble and a quarantine, but an almost guaranteed life. For an unvaccinated one, it's a death sentence. Rabies is the only disease with a 100% fatality rate that can be 100% prevented. But for now, remember the main thing. If you hear someone say, "I don't vaccinate my dog," the vaccine ruins the liver. You are looking at a walking biohazard. Do not pet tame foxes. Do not reach into animals' mouths without gloves. And vaccinate the ones you've tamed. Stay safe. Let me know your thoughts on pet vaccination in the comments, and drop your ideas for what we should dissect next. We will continue to dissect brutal myths on this channel. Subscribe to know your enemy. And if you appreciate the unvarnished truth about animals, check out my other project, Heart of the Wild. There, I explore the real history, working qualities, and true nature of dog breeds without the sugar coating. The link is on the screen. Thanks for watching.